So good morning, everyone. We are here this morning, Friday, April 30th, with a special presentation with Dr. David Carlisle from Charles Drew University. Dr. Carlisle?
Okay, well, greetings to all the students from King Drew Magnet High School. And yes, indeed, we are your neighbor, as I'm sure you know, Charles R. Drew University of Medicine and Science. I'm looking forward to the day when, I can give this presentation in person. But for right now, virtual will have to do. That day is getting closer and closer as we speak, but that's another subject for another time. It's great to see you all. I'm going to share my screen and then we can come back for questions at the end. And remind me, Ms. Thigpen, how much time do we have?
You have about 50 minutes.
Okay, well, that's a great amount of time, and the presentation will be less than that, and we'll have time for questions. So here we go. I will share my screen. Put this into presentation mode. And Ms. Thigpen, is that transmitting properly?
Yes, I can see your presentation.
Okay, great. So this is a talk entitled, So You Want to Be a Doctor. And I know that some of you, many of you, maybe all of you who are here this morning are thinking about careers in medicine, specifically as doctors. And I want to give you some insight into what this is all about and kind of how to do this. Even though you may be juniors or so in high school, it is not too late to start thinking about what it means to be a pre-med student, because all around the country, other high school students are already thinking about being pre-med students. I talked to my personal physician, and her daughter, who is a junior in high school, is already planning on how to be a pre-med student. We've had a lot of conversations about this. So it's not too early to think about becoming a doctor and what it means. So yes, so you want to be a doctor. Well, what are you getting into? Well, first of all, there are a lot of good reasons to become a physician. And we'll talk about other types of doctors as well. But today we're talking about being a physician, being able to carry this in your wallet. This is my Department of Consumer Affairs card. I don't know if you can see that, but I have to carry my medical license, physician and surgeon license, with me at all times. If you see me walking across the campus, you can come up to me and say, Dr. Carlisle, can I see your license? And I should be able to produce it. Why do you want to be a doctor? Well, typically, let's say you're on an airplane and you're flying to New York, or you're flying to Hawaii, or you're flying to Sacramento, and it's 30,000 feet and you're in the air, and they come on the PA system, and the flight attendants never go, is there a lawyer on board? They never go, is there a management consultant on board? You never want to hear them go, is there an engineer on board? That's what you never want to hear. But typically, the only thing they come on the PA system to ask for is there a doctor on board? And if the answer is no, then the next thing they'll probably ask is there a nurse on board? But we'll get into that later if you want to. We're the only profession where emergencies can occur anywhere that involve us. I've pulled over on the side of the road to do first aid stuff after seeing a car accident, waiting for paramedics to get there. That's kind of what we do. That's what we're expected to do. The other good thing about being a doctor is, people can't pay you in money all the time. People can't pay you with health insurance all the time. That's not why we go into we're doctors. That's not why we go into medicine. We don't go into medicine to become rich. We don't go into medicine for the prestige. We don't go into medicine for the gratification, except the gratification when a patient says, when you have finished seeing them, "Thank you, doctor." That phrase, "Thank you, doctor," explains everything about why we went to medical school. It explains everything about why we have taken so long to finish our training. It encompasses everything about being a doctor. When the patient says, "Thank you, doctor," that's what it's all about. Another thing about being a doctor is we can be a doctor anywhere in the world. I can go to Malaysia and be a doctor. I can go to the Democratic Republic of the Congo and be a doctor. I can go to the Amazon jungles and be a doctor. I can go to Germany and be a doctor. I can take my license and practice my profession anywhere in the world. And it's most professions do not have that flexibility. Another reason to be a doctor is I can be seeing anybody for my patient. I can see a corporate CEO of a Fortune 500 company one moment, and the next person that I see could be a homeless individual who only has Medi-Cal for health insurance. That's one of the nice things about being a doctor, is I can literally see anybody and take care of anybody from moment to moment. And that's a wonderful thing about being a doctor. Perhaps the best thing, just to kind of sum this all up about being a doctor, is that it's a wonderful blend of technology and humanism. We're with patients when they're dying, but we're also involved on the technical end of things, running machines, doing catheterizations, doing surgery. But in the end, coming up to the bedside and saying to a patient, you're going to get better, the surgery went well, or saying to a patient, there's nothing more we can do. That's all part of being a doctor. Why not be a doctor? Well, it's really, really hard work. If it wasn't good work, it would just be really hard work. But the good work makes up for the hard work. But, I tell my friends, I work 7 days a week. I get up at 4:30 in the morning. I get up at 4:30 in the morning, and I'm probably not the first doctor who's up that morning. When we're interns and residents, we work 90 hours. I've worked 40 some hours without going to sleep. It's difficult. It's stressful. I had my first patient die when I was an intern, literally about a week after medical school. That was my patient. My patient died. I had the stress of one day calling a family and saying, don't come pick up your grandfather right now, because we just opened up a slot in the radiology suite and we can get his CT scan right now instead of waiting a week after he gets out of the hospital. What happened was I had to call the family back an hour later and say, we just had a code blue in the radiology suite. It was your grandfather. He did not survive. That is stress. We have to be able to go from one room where we've had to resuscitate somebody and maybe we haven't done well, and go into the next room and say, good morning, Mrs. Johnson. How are you doing today? That's stressful. Healthcare and being a doctor is one of the most stressful occupations out there. But of course, the good aspect of it makes up for the stressful aspect of it. Delayed gratification. I'll show you this later on. Doctors put off and put off and put off and put off those things that make life especially enjoyable. Having a family, getting married, buying a house, all those things doctors put off because their number one priority is becoming a doctor. Student loans. Medical students today will often graduate with over $300,000 of student loan debt. In many places in the country, you can buy a house for that kind of debt. Why do they do it? Because it's worth the investment. And it's not just worth it from a monetary standpoint. The pleasure of being a doctor is worth the financial sacrifice. And that's why medical students take out $300,000 of student loans. A compensation. Doctors, whether they're making the probably the lower salary that doctors make, pediatricians may make less than $200,000 a year, or the upper salary range of doctors typically. For some of our surgeons, it can be $500, $600, $700,000 a year. But regardless of where the doctor is in that spectrum, they're among the top income earners in the United States, certainly within the upper 5% of all income. Income is not an issue for doctors, and doctors don't spend a lot of time necessarily thinking about their income. So doctors, wherever they go, are well compensated, and many doctors do what they do for free and volunteer. So these are reasons why you may not want to be a doctor. But there are some other reasons, and I want to be clear about this. Being a doctor is dangerous. Look at the headline on the right. 28-year-old obstetrics gynecology resident dies of COVID-19 after treating coronavirus patients in the emergency room. Doctors die. Doctors die every day from patient care. When I was a resident, when I was an intern, after graduating from medical school, I went to work at LA County Harbor UCLA Medical Center. Most of my class of about 20 residents all became TB skin test positive. I was lucky I didn't. But I was also lucky because this is during the dawn of the HIV epidemic. We didn't know what it was at the time, but we knew that it was bloodborne. And here I am with my team. I was in charge, and we're sewing a central venous line into the chest of a patient at the bedside, sewing it in so the patient wouldn't accidentally pull it out. And it involved a big curved needle, about 1.5 inches long, and these things called hemostats to hold the needle. And I had 2 sets of gloves on because I knew that we were dealing with a bloodborne infection, but we didn't know what it was. And as I was sewing in the needle slipped within my hemostat and went through my glove. And at that time, we didn't know. We thought that such a needle stick could be fatal. So I gave the hemostat to the intern and said, "Here, finish this up." I went into the restroom, took off my first glove, put some water in it, squeezed it, and watched while the water dribbled out of my first glove. I said, "Oh, that's not a good sign. That means the needle definitely went through my first glove." I took off my second glove, filled it with water, squeezed it. And good news, no water came out. That meant that the needle did not go through my second glove, did not pierce my skin. But if I didn't have 2 gloves on, it could have pierced my second glove. I could have been infected with the HIV virus. At that time, there was no treatment for it. If I'd been infected by HIV, it probably would have meant that I would have been dead within 2 years. My wife, as a resident at LA County USC Medical Center, had to call in our safety officers, LA County Sheriff's deputies, because a patient that she was taking care of with a medical student from Holland was combative in the emergency room. He was high on what was called angel dust at the time, PCP. And they were putting these leather restraints on this patient. The patient broke loose of the leather restraints, grabbed a gun from the safety officer, and my wife is at the head of the bed with a medical student from Holland, and started firing the gun off in the emergency room. My wife dropped to the floor. What she didn't see was that the large safety officer, a gentleman about 6'3", 250 pounds, went running out of the emergency room saying, "I'm going to go get help," leaving the 2 smaller safety officers, 2 women, each weighing less than 125 pounds, to deal with the situation of the patient firing this gun off in the emergency room. Well, one of them took a bullet in the shoulder, but she was able to wrestle the gun from the patient. And unfortunately, what she did next was fire the gun into the chest of the patient. Patient died. Later on that evening, my wife realized that she had not seen the medical student for a couple of hours. When searching all through this massive structure, LA County USC Medical Center, finally found the medical student still locked up inside a bathroom crying, and said, we don't even have guns in Holland. Nothing like this would be possible in Holland. What would you tell my parents if I had died? Doctors experience depression. We have to deal with failure. And often we're so tired that when we're driving home, we fall asleep. I remember driving home from an emergency room shift overnight when I was an intern. And fortunately, the speeds were low on the 405, driving north in the morning, rush hour, stop and go traffic. I fell asleep, woke up before I ran into the bumper of the car in front of me, but I could have been going 70 miles an hour. That may not have had a happy ending. So yeah, being a doctor is dangerous. We're exposed to all sorts of dangers. And so it's not a profession that you enter very superficially. It's not like being a lawyer. It's not like being the CEO of a company. Doctors go to work every day knowing that it's dangerous, especially in the era of COVID-19. 20% of the fatalities that have occurred in COVID-19 have been among healthcare workers. So switching gears, some of you probably want to know what is a doctor. And this will get a little bit technical. I'm going to be saying a whole lot of words to you. Most of them end in IST. And if you don't know what these words are, don't worry about it. You'll be hearing them again soon. But you probably recognize most of what I'm going to say in this next slide. So really, there are two types of physicians. There's the allopathic physician, which is what I am. We have MD degrees. And then there's the osteopathic physician. You go to Western University, you get a DO degree instead of an MD degree, and you're an osteopathic physician. Basically, the distinction between the two kind of stops there, because after school, after medical school, and we all go to medical school, we go on to train the same way. There are many more MDs than there are DOs, however, but I want to make sure you know that you can become an osteopathic physician. But there are all sorts of other types of doctors. There are nurses who are doctors, doctorate of nursing practice. There are public health professionals who are doctors. There are psychologists, and they have PhDs. There are chiropractors. There are dentists that have DMD degrees. Pharmacists are doctors. Physical therapists now have become doctors of physical therapy. The optometrist who does your eye examination is a doctor. And then there are all the PhDs as well. So, and I could go on and on down the list. So there are all these other doctors apart from medical doctors. And if you want to become a doctor, think about some of these other occupations as well. But let's talk about the medical doctors, and say that you've gone to medical school and you're either a DO or an MD. So now we can talk about the different specialties of medicine. The biggest specialty in medicine is internal medicine. And most people don't know what internal medicine is. Internal medicine is my specialty. And internal medicine is like pediatrics for adults. We take care of everything: heart disease, arthritis, digestive problems, ulcers, headaches, you name it. Internal medicine doctors typically take care of it. What we don't do is surgery. Surgeons do surgery. Internal medicine doctors don't do surgery. What we do is we'll put needles in people. We can do, biopsies and do all this stuff with needles. Indeed, remember when I had that possible HIV exposure, I was sewing in a catheter in somebody's central vein in their upper chest after putting the catheter in using a very large needle. Obstetrics gynecology, these are the doctors who deliver babies. Psychiatrists, I think everyone knows what a psychiatrist does, but probably what you don't know is that most of what psychiatrists do is prescribe medication. Most counseling is not done by psychiatrists. Family medicine doctors, primary care, emergency medicine doctors when you go to the emergency room. So these are all called specialties. And you do get a specialty by doing residency. More on that later. And then within the specialties, there are subspecialties. Now, I'm just listing a few, but for example, internal medicine has about 15 subspecialties. For example, one is cardiology. I think everyone's heard about cardiologist. You may not know about rheumatology or joint doctors. Rheumatologists take care of patients with lupus. Also, critical care doctors in ICUs, and the list goes on and on and on and on. These are subspecialists, and you get your subspecialty training after you do your residency, and I'll show you more information on that. Surgeons have subspecialties. Your heart surgeons, cardiovascular thoracic surgeons, they've done a subspecialty fellowship after they've done their surgical residency to become a surgical specialist. Trauma surgeons, same thing. Plastic surgeons, the same thing. Orthopedic surgeons, the same thing. So let's go back to the pathway, and we'll come back and talk about all these specialties and subspecialties a bit. But I want you to know how long the path to becoming a doctor is. It is not for the faint of heart. It's like an endurance race. And I will say, and I'll say it again later, becoming a doctor is like being an athlete. It requires focus, dedication, commitment. It requires resilience. It requires tenacity. Just like being an athlete, what do you do when you lose the big game? You get back on the field or the court and get ready to play the next one. You have to keep going. So that's the pathway to becoming a doctor. It starts typically at age 18 when you enter college as a pre-med student. You're 18 years old. You finish college and you've gotten into medical school. You're now 21 years old. And yeah, there's a whole lot more room on the right part of this arrow. This is just the beginning. You start medical school at age 21. You finish medical school and you start your residency at about age 25. And residency, depending on the specialty, internal medicine is 3 years, surgery is 5 years, psychiatry is 4 years. So you start at age 25, you spend about 3 to 5 years as a resident. And then when you finish your residency, or you've done your first 3 years of residency, you're eligible to get your medical license in the state of California. So you start your residency at about age 25. And by the time you finish your residency, you're about 28 or 30 years old. But again, that may not be the end of your training. If you want to become a subspecialist, a cardiologist, a trauma surgeon, a pediatric oncologist, you have to do a fellowship after your residency training. You're already a surgeon, you're already a pediatrician, but now you do subspecialty training. And that is typically another 2 or 3 years. So that brings you to the age of 33. And now finally, you're ready to go into practice, or you're ready to join a medical school faculty, or whatever you're going to be doing for most of the rest of your career. It is now, 15 years after you first became a pre-medical student. And again, this is a long pathway. If you were a professional athlete at age 33, you'd be thinking about retiring. As a doctor, you're just starting your career. And the difference between a doctor and a professional athlete, at age 33, the doctors are typically thinking about another 30 or 40 years of practice, basically. So what does it take? How do you apply to medical school? And again, the reason we're talking about this is all around the country, there are students who are in high school, junior year of high school, who are now thinking about applying to medical school. They are your competition. And I want to use the word competition because, again, this is competitive. I don't want to de-emphasize the competitive nature of applying to medical school. Remember, preparing to apply to medical school is like training as an intercollegiate athlete. Long, long hours studying, working, studying, working, and then studying and working all over again. I'll tell you my personal pre-med story. And this talks about the word tenacity. So here I am, I'm in my first year of college. I'm at a private New England four-year university, a university with a reputation of being a pre-med factory. And I can tell you the name of the university right now, but it could be any number of universities around the country. And I'd come out of high school. I was a very good high school science student. And I thought I had no reason to think that I wouldn't be a very good college pre-medical student. And then I took my first biology examination. And I didn't think I would do poorly on my examination. I got my grade back, 50 something. I had flunked my first biology examination in college. And I said, whoa, what is this all about? This isn't like being in high school anymore. All those other students, over 100 students in my biology class, they're my competition. My goal here is to get an A in this class, and I just finished the first lap in last place. I had to change what I was doing. All of a sudden, I was staying up until 1 o'clock in the morning before 8 o'clock in the morning classes, studying. I was no longer going out on weekends. I might go by a party, spend an hour there, go back to my room, study. In the end, of those over 100 students, I got the third highest grade on the final examination in my class. I got an A in the class. But the point is, in order to be successful as a pre-med student, you have to be tenacious. And yes, everybody that I know of who applies to medical school has had to rebound after some sort of failure. And this is characteristic. It's not all about getting those A's. It's how you get those A's. And it's what you have to go through, because everybody has had to deal with not getting an A and recovering from it. Now, I know this slide is really hard to see. You don't have to really pay attention to these numbers. This is from the Association of American Medical Colleges. This is public data. And what it shows is GPAs and Mcat scores. And I'll show you more information on this later on. The Mcat is the Medical College Admissions Test. It is a standardized test that every medical school applicant takes. The point about this slide here, though, is in the lower right-hand corner. Over a 2-year period, over 100,000 people applied to medical school. Only 60,000 got in. That's about 42% of all applicants. Only 42% of medical school applicants get into medical school. And important point, these are students who have gone through the pre-medical process for over 3 years and now seniors in college. They've survived organic chemistry. They've survived biostatistics. They've survived introductory physics to get to the point where they have the opportunity to apply to medical school. And of those students who've survived and made it that far, only 40% get into medical school. This is actually better than it was when I applied to medical school. Only about 1 in 3 students at that time got into medical school. But 40% is a low number, especially when you think of the fact that they've already gone through the pathway. They've completed the pathway. And here they are, they're ready to apply. Only 40% get in. At CDU, I just want to share with you information about your neighbor next door. We get over 3,500 applications to our medical education program. We only interview or request, a secondary application from about 350 of those applicants, 1 in 10. We get about 250 of those applications back. At CDU, we only do about 100 interviews, usually less, for those positions, 100 interviews out of 3,500 applications. And of those students that we interview, those applicants, we only accept 24 into our regular program and 4 more into our expanded prime program. That is less than 1 in 100. That is typical for a medical school. 1 in 100 students get accepted. How do you even those odds as a medical school applicant? Well, you do the math. You apply to a lot of medical schools. You apply to 16, you apply to 20. If you can afford it, and these applications cost typically more than $100 per application, you apply to more than that. And you try to bring down those odds closer to being in your favor. But it's typically 1 in 100. And we're going to go over this, we can go over this later, but, here's the process. You're in college. You want to aim at that standardized test. You want to make sure you've taken all the course requirements. But in terms of the undergraduate major, you don't have to be a science major to apply to medical school. In fact, if you are a art major, if you are an anthropology major, if you're a Spanish major, you've actually just increased your odds of getting into medical school, because assuming that your Mcat score is competitive and you've got a good GPA, the medical school will look at you and go, oh, you're a Spanish major, and you're competitive. That makes you special. And they like special students. So you don't have to be a biology major. You don't have to be a chemistry major. But you have to make sure that you've taken all the course requirements. And then, as I mentioned, you submit your primary application, you get invited to send in a secondary application, you do an interview, and hopefully you get in. And then you have to make a choice about where you want to go to medical school if you get into more than one medical school. I'll talk about this a bit later. It really doesn't matter where you go to medical school. I just want to underscore that. In the United States, the medical education process is rigorously standardized. Most medical schools train doctors the same way, and it doesn't matter a whole lot. There are some nuances, though, that we can talk about. So let's go into some tips on applying to medical school. Where you get your grades matters. An A from a community college is not viewed the same way as an A from a Stanford or a UCLA or a Harvard. Medical schools weight where the grades come from. And so where you get your grades matters. Don't take your pre-med requirements at anything but a very highly competitive institution, if you can at all avoid it. More on that later. Another myth, getting a C in organic chemistry doesn't necessarily disqualify you from applying to medical school. There are lots of advisors, typically not doctors necessarily, who will tell a pre-med student, you just got a C in organic chemistry? Well, that's it for your medical career. That is not true. You can make up for that C in organic chemistry by doing other things. So don't think that C is going to keep you from being a doctor, but you have to work and come back from it. And so here are Mcat scores. And we're going to talk about Mcat scores and admission rates. So the average Mcat score is somewhere between 502 and 505. The test is designed so that a 500 is the average score, but then we've seen the scores creeping up. Again, only 40% of applicants get into medical school. So what you want to look at, though, is where that 60th percentile is on the Mcat score. And the 60th percentile for the Mcat, and let me see if I can move my screen around here, is a score of around 506, 509, 510. And you really don't start to get into that favorable territory until you're around 510 on your Mcat score. That is above average. And the reason I'm saying all this is that the Mcat score is the dominant predictor of who gets into medical school. I'm not happy with that. I don't think that it is the best predictor for who makes a good doctor. But the reality is more and more medical schools are putting more and more weight on Mcat scores. So as a pre-med student, not only do you want to get an A in organic chemistry if you can, or biology or whatever, You want to master that subject matter so that when it comes up on the MCAT, you can nail those questions. But there are a couple of points here on this graph. At the far left, MCAT scores below 490. Note that the chances of getting into medical school with an MCAT score, as shown by this blue line, of less than 490, they're pretty bad, way less than 10%. But the point is, they're not zero. Some students get into medical school with MCAT scores of less than 490. How do they do it? There's something very special about those students. And if there's something very special about you, you can overcome those really low MCAT scores. And look at all the way at the other end of the graph, the top categories of MCAT scores, greater than 517 on the MCAT. We're talking about the 90th percentile MCAT scores, 95th percentile MCAT scores. Not 100% of those students get into medical school. So you can have the best standardized test score and still not get into medical school because you may be deficient in other areas. Maybe it's your grade point average that's really poor. Or maybe your interview, you bomb your interview and it did not go well. And the medical school interview committee or the admission committee will be going, well, this person is obviously really smart, but that doesn't mean that they're going to be a good doctor. In fact, they just demonstrated to us why they probably won't be a good doctor. Maybe they show no empathy. Maybe they show no sensitivity. Maybe they show no interest in under-resourced populations. That's why that interview can make a difference. Maybe their letter of recommendations are not strong. So you can have the best MCAT scores and still not get into medical school. Now, this slide is important also. And what it says is why the MCAT score is really increasingly the dominant predictor, especially compared to the grade point average. Pretty much all the applicants to medical school have at least B pluses as their GPAs in the 3.2 to 3.6 range, A minuses. Typically, they're coming in with GPAs above 3.6. I mean, these are solid A students. There's no variation in this group. When I applied to medical school, my GPA was around a 3.4, but my MCAT score empowered me through the process. So again, don't focus on the grades so much. Focus on what's behind the grades. You need to know that biology. You need to know those physics courses. You need to know that chemistry so that you can get that MCAT score that is up there. Because the GPA, pretty much all of your competition is going to be in the A or the B plus category when you apply to medical school. So again, just to summarize, the MCAT score is a more important predictor of getting into medical school than the GPA. Yes. Having a top MCAT score or top GPA does not guarantee medical school admission. It is possible, and I don't want to encourage people to go down this pathway. It is possible, but very unlikely to get into medical school with a low MCAT score or GPA. Yes, it happens. But if you want to optimize your chances, focus on that standardized test. So yes, do everything you can to optimize your MCAT score. Another point, medical school applicants think that they have to be doing research stuff in the summer. It's not all about research. In fact, so many medical school applicants have been in this lab, that lab, doing this research, that research, that it's kind of mundane. We were kind of more interested in seeing that student that spent the summer in Central Africa taking care of patients with malaria. We like the students that have worked as volunteers at public clinics, discharging patients. When I was working at a free clinic, a community clinic, medical students were often what we call the patient coordinators. And after I saw the patient as a doctor, after the pharmacist saw the patient and gave them their medication, they'd sit down with the patient coordinator and discuss what to do with their medical problem. Those patient coordinators were often pre-med students, and they were all very likely to get into medical school. They weren't doing research. And this happens a lot, especially among high school students. You know, don't tell a medical school faculty member that you want to be a pediatric endocrinologist, or you want to be a doctor so you can be a cardiac surgeon. Because we know the reality of medical education is you come to medical school and you change your goal 3 or 4 times. Most medical students have never heard of a radiation oncologist, somebody who treats cancer with X-ray beams. But maybe in medical school, they take that rotation, they say, wow, this is fascinating. I want to be a radiation oncologist. Most medical school applicants really don't know anything about anesthesiology. They get to medical school and they go, wow, this is an amazing profession. I want to be an anesthesiologist. If you say you want to be, say, a heart surgeon or a pediatric endocrinologist, what you might then get asked is the question, well, tell me why. What do you know about that specialty? And if all you know about that specialty is maybe what you've heard or seen on TV or something like that, your stock has actually kind of just sunk, because the doctors know that there's a lot more to medicine out there. The best thing to say is, I want to be a doctor because I want to take care of patients when they're sick. And I'm interested in this specialty, but I understand that there are a whole lot of other ones out there. So don't tell me necessarily that you want to be a heart surgeon or a brain surgeon or a pediatric endocrinologist, because that tells me that you really don't know what healthcare is all about necessarily. Unless you spent time working for years with maybe a heart surgeon, maybe your aunt is a pediatric endocrinologist. If that's the answer, yeah, that's a good answer. Don't tell me that you want to go to a particular medical school. I'm the president of Charles R. Drew University. Yes, we have a medical education program. Yes, we think our program is special. We think that it's unique in its own way. But again, every medical school is pretty much the same. In fact, they're so identical that it probably doesn't really matter where you go to medical school. You can get a lot of what we offer that makes us unique at Charles R. Drew University, at UCLA, at USC, at the University of Washington, at Harvard, at Howard. It kind of doesn't matter. So if you come to me and say, Dr. Carlisle, I really want to go to Charles R. Drew University, I go, well, that's nice to hear, but it makes me think that really what you're doing is kind of patronizing me. Don't be patronizing when you're talking about medical school. Just get into a medical school, any medical school, and the attrition rates are so low, less than 3%. When you get into medical school, you are going to be a doctor. You get into 2 medical schools or more, then we can sit down and have a conversation about why one might be better than another. One might, be better suited for your own learning style. Maybe one is closer to the area that you might eventually want to practice in or live in. Those are valid reasons to choose one medical school over another. But when you're applying, please don't tell me that you like my medical school more than any other one in the country, because that actually doesn't elevate our perceptions of applicants when we hear that. Another point, in terms of where you go to medical school rankings are kind of immaterial. It's not like law school. Both of my kids are lawyers. And law students would rather go to one law school than another, because the first law school is ranked number 4 on a national ranking, and the next law school is ranked number 5. It's not like that for medical school. Again, pretty much all medical schools are the same. It's actually better to be the best medical student at a medical school that people think is lower ranked than to be the best medical school student at a top-ranked medical school. Why? Because you get a lot more attention when you're the best student. And you'll come out with good grades and good letters of recommendation. So again, the rankings really don't matter. It's better to be the best student at the worst school than the worst student at the best medical school. So I want to close by talking about life as a medical student and beyond. And this is an image. I have his name here because I borrowed this from a publication by CNN. And here we have Russell Levitt down in New Orleans, a medical student at Tulane University. Pre-Dr. Levitt used to work as a security guard at the hospital where he was doing his training. I've never met him. I hope that someday I have a chance to meet him, but regardless of whether I meet him or not, I am very proud of him because he exemplifies what it means to be a doctor. He exemplifies the type of doctor that we want to see. And I know that he is going to make us proud as a physician. And I can just tell that by looking at him and thinking about where he came from and how hard he had to work to become a medical student. And again, once you get into medical school, you're virtually a doctor. Yeah, you have to put in the time, you have to finish the courses. The attrition rates are so low that every medical student graduates and becomes a doctor. And that's why I call medical students pre-doctors, not necessarily medical students. Again, life as a doctor is really hard, but it is immensely, immensely rewarding. There are few professions that I would say are better than being a physician. Some of them could be health professions. I could have a debate with a registered nurse, and I might not even be on the side of the debate that you might think I'm on about which profession is the best one, being a nurse or being a doctor. I actually rate being a dental hygienist as a really, really awesome health profession. And it goes on. In fact, typically among the top 3 occupations or top 10 occupations out there, 4 or 5 of them are health professions. Being a physician assistant, being a dentist. I mean, it just goes on and on and on. Again, it all comes down to seeing that patient. And at the end of that encounter, or if you're a veterinarian, it was pointed out to me the other day, seeing the client with their pets. And at the end of the encounter, having that person turn to you and say, "Thank you, doctor." That's the kind of reward that you don't get as a lawyer. That's the kind of reward you don't get when you're the CEO of a Fortune 100 company. That's the kind of reward that you don't get in virtually any other occupation. And it doesn't matter whether that person can pay you or not, but you're trying to do the best that you can when you see them. And there are few occupations where that is always the truth. So let me close by saying thank you, not doctor, but thank you, aspiring pre-doctors, for allowing me to address you this morning. And I think I'll stop sharing my screen now and see if there are any questions.
So Jocelyn, do you want to assist with that?
I'm actually having trouble.
Okay.
I stopped
Yeah.
sharing.
If anybody has any questions, feel free to put them in the chat and I will read them for you guys. Or if you would like to unmute, go ahead and do so. Speak now or forever hold your peace.
It's okay to ask me questions. I don't mind.
Yeah. He's
Just remember,
here.
there's
I know
no
a lot
such
of you
thing
guys.
as a dumb question.
Yeah.
Okay, I'm seeing questions in the chat. How long did it take to pay off the student loans? Well, for me, I was unusual. It takes most doctors about 20 years to pay off education debt. So, you enter practice at 33, you're probably paying your student loans off until you're into your 50s, truth be told. But that's not an impediment. I mean, we would all do it all over again. In my case, I paid for, or I shouldn't say paid for, I borrowed to pay for half of my medical education. And then I joined the National Health Service Corps to pay for the other half of my medical education. They gave me a stipend when I was in medical school. and I agreed to work as a doctor when I finished my residency, anywhere that they wanted to assign me to. I thought that I was going to be going off to be shipped off either to the island of Guam or maybe the Mississippi Delta. And I remember sitting up, it was about 10 o'clock at night, the day before the NHSC announced where they were going to be sending the scholarship recipients to. I got a call from the medical director of the Watts Health Foundation right up the street from the high school, about a mile away. And he said, Dr. Carlisle, do you want to come work for us? Because we're taking NHSC recipient scholars here at the Watts Health Center. And, being a quasi-Angelino, I said, I'll just say blank, yes, absolutely. And actually that experience changed my entire career because at the Watts Health Center, they wanted me to get an MPH. And I went to health policy and I did all these other things. And ultimately I ended up as the president of Charles R. Drew University. I attribute all of that to being in the National Health Service Corps and being assigned to the Watts Health Center. Let's see, I'll open my chat window.
There's another.
Go ahead, Jocelyn.
It says, is being a psychology major great for getting into med school?
Yes, absolutely. I'll say that any major is great. Because I don't know what it is. I know that there's a number out there, but let's say 75% of medical school applicants are science majors, human biology, chemistry, something like that. And I'm not saying that psychology is not a science. I don't mean to imply that, but I'm not including psychology in that group. You actually increase your odds of getting into medical school by being a non-science major, assuming that you have a competitive Mcat score and a competitive GPA. You will get through the first round of screening where you want to have competitive scores and grades. And then when you get to the second round of screening, where they send you your secondary application and you get ready to be interviewed, and they'll go, this applicant is different because they're not a science major, but they've already demonstrated that they can handle the sciences. So we know they can be a successful medical student, but they're bringing something special, something extra to our class. At that point, you're more likely to get admitted than a science major.
There's another one here that somebody sent to me that says, if you can't get into med school or you get in and feel that it's too hard, what should you do?
Well, that actually hardly ever happens. The medical students are typically selected because the medical schools know that they can do the work academically. And if you feel that it's too hard, it doesn't mean that you shouldn't lose your motivation to becoming a doctor. It means that you should probably have a conversation with the medical school support staff about why it is so hard and see what they suggest for you. Maybe you have to take an extra year in medical school. Maybe it's simply that you need to change your study habits. When I got to medical school, I was a science major, and I thought everything came down to formulas and theory, basically. I got to medical school, I tried to figure out what the formulas were for anatomy, human anatomy, and what the theory was. There weren't any formulas. There was no theory in anatomy. I was bombing anatomy for a while until I said, well, okay, forget all the stuff, all the way you approached being a chemistry major, and start to memorize stuff. And when I started to memorize stuff in medical school, using a different learning technique, my academic performance changed, like literally overnight. And so maybe it's just the wrong way of studying. Only 3% of medical students don't fail to graduate. Typically, it's not for academic reasons. Typically, it's for financial or psychological reasons. So, you're in medical school because they know you're good enough academically to become a doctor.
All right. The next ones would be, how do you avoid student loans as a college student?
Loans as a college student are more difficult to avoid. You can work as a college student. I worked as a college student. I discourage people from working in college as much as possible. I would recommend taking out loans, but the alternative to loans in college is try to find if you can qualify for any sorts of scholarships. That is the antidote to debt, basically. Not everyone has rich parents. Not everyone has rich uncles or aunts. Try to get scholarships, but I would say try not to work, because the more you work, the lower your grade point average goes, and the lower your Mcat scores go.
Okay, and this next one says, what is the biggest challenge you faced? The biggest challenge you faced in your medical career?
Well, I think I've actually already spoken to some of them. The biggest challenge is not being able to do everything possible for a patient, or maybe to put it another way around, doing everything possible and still not being successful. And I've taken care of a lot of young people who've had very dire medical situations, and not all of them have pulled through. Whether it's somebody with a severe injury. I had a 17-year-old patient who had an overwhelming infection. We tried everything we could do to save her. We were unsuccessful. That's kind of the biggest challenge. And those patients leave memories with you when you go through that as a doctor.
Well, I'm going to jump in. I believe we are reaching the end of our period, and there's research day at Charles Drew University. And I know you're popular. You have a speaking engagement there next, but we appreciate you being with us. We will stop recording.